My name is Obondo. I work for the Salvation Army. The Salvation Army is an international organization with a presence in 130 countries of the world. In Kenya, the Salvation Army came here in 1921. So the Salvation Army has been around for quite a long time. She has mentioned part of what we are doing. We are a church, we are a faith-based organization, as well as a development organization. So I know many people in Kenya usually get surprised when they hear the Salvation Army. But I want to let you know today that the Salvation Army is very much involved in development initiatives, especially in the education. Currently, we are also doing one of the biggest integrated WASH interventions in this country, in the 3 counties of, that is Kitui, Machakos, and Makueni. And come next year, we'll be moving north to Isiolo and Samburu. As a result of that, we are also members of the WASHnut Expert Group within SIANI. That's why I'm here today. They requested me, George, because you are our member, and this meeting is taking place just close to you, represent us. So I'm presenting the WASHnut Expert Group in this presentation. And today, I will share with you some of the things that we have done as an expert group. First, let me begin with WASHnut, because I think that is an acronym that is really disturbing you. I can see from your faces. So the WASH is simply water, sanitation, and hygiene. And the nut there is nutrition. I know from previous presenters, you have been talking about food. But I want you now to hesitate a little bit and think about water. Because without water, there will be no food. That's why I'm here. So, those are our members. Salvation Army is one of them. Majority of our members are institutions. In Sweden and also in Kenya, we have quite a good number of members. One of us is also sitting there and is a presenter just after me, Steve Vundi Mungula. So this expert group aims at looking at the contribution that water, sanitation, hygiene has even in agriculture, in sustainable agriculture. So we have done 2 things. First, when this expert group was formed, we looked at the linkages that there are between water, sanitation, hygiene, and agriculture, and food security. And today I will just share with you some of the findings. It's just case studies that we have had. Then after that, the expert group looked at the expert group now looked at how these partners are working together, how the cross sectors are collaborating with one another. Those are some of the things. So this we have done through meetings, through sharing of experiences, through visits, and through surveys. When we talk of water, sanitation, nutrition. There are a lot of things. So this is just the first web when we tried as an expert group looking at the linkages. And we realized that there are really several. And I'll just pick a few, for instance. Water is needed for crop production. Water is needed for irrigation. Water is needed at the household level. So water has the potential of creating advantages, but when it is contaminated again, it is creating a challenge. Yeah? Look at the waste, the human waste, for example, when you look at the sanitation. When you look at the human waste, because after consuming food, naturally you will attend to the call of nature. So how do you dispose of your waste? So when that waste is disposed to the environment, in the open, again, it creates problem even to the people that you are targeting with health. Because why are we consuming food, for instance? We are consuming food because we want to draw good health from that food. When that food is contaminated, you know what happens. There are diseases. Yeah? For instance, here in Kenya, open defecation currently is a big thing. And this is a byproduct of food consumption. Yeah? This country, Kenya, for instance, loses on annual basis in economic terms 27 billion Kenya shillings annually out of open defecation. So currently, partners are trying really to fight open defecation. Going to very many countries here, people are trying to get rid of open defecation. The approach that is currently being used by and large is the community-led total sanitation, where populations are encouraged to construct latrines and to use those latrines. And also to practice hand washing, effective hand washing at critical moments using soap. So that is just an example. But as well, we are looking at waste not as something that is bad per se, but we are looking at waste also as something that can be turned into an economic use. So some of the partners, and in the later stage slides, you will see some of the things that as an expert group, we tried really to draw from experiences. How do we even turn waste into products, into fertilizer? Yeah, I know that there are cultural issues concerning use of human waste as a fertilizer. People think that when you use human waste as a fertilizer, you will be consuming feces. So some of those cultural things, I think, so the first tasks that we conducted as an expert group was to look at the various linkages, and we came up with some key findings from that task. And one of them is that sanitation is both an opportunity and a threat. I've mentioned that. The second bullet is that integrated management of water, sanitation, and hygiene offers critical opportunities for promoting food and nutritional security. Integrated management is technically feasible. However, it is hampered by several barriers, including silo thinking, lack of cross-sectoral communication, and lack of working models. We realize that we don't lack knowledge, the technical knowledge or skills. Yeah? But what we lack is are models. We are lacking models that somebody can pick and say, this is an integrated model that, yeah. So those ones, I think you'll read those slides by yourselves. So the second task that we set as an expert group to do, we looked at now, how can we learn from existing projects that are ongoing by various organizations, yeah? Then we picked 10 case studies around, yeah, I'm seeing that my time has really run. So we organized the study, those case studies on several questions, on motivation, what motivates, for example, working cross-sectorally, facilitation in early stages, overcoming challenges, resilience, and cross-sectoral work. So on motivation, those are the organizations that we talked to. We learned from, we studied their works. The people in Kenya, International Aid Service, SANAG, the Salvation Army, Community Initiative in Tanzania, and the rest. So what motivates, the question on motivation, because motivation can be something which is pushing you to do something, and motivation can be like a carrot. What are the pull factors? So these are the things that we established, that some of the push factors included crisis, can motivate people to work cross-sectorally. Yeah. And there is also the complexity, the demand-driven, healthy community needed. So under the push factors, we looked at government encouraging people to work cross-sectorally so that we don't just work in silo, for us to draw benefits. And then there is the research inspired. People are inspired by research to work cross-sectorally, because there is a lot. When you are working cross-sectorally, then you draw from experiences of others, you learn from the knowledge they have, the skills, and the rest. There are also economic factors, environment, and also the value additions, and also the prestige of even coming together to work as a people. And the question of what challenges at intervention stage are specific to cross-sectoral projects. What are the challenges? Then we realize that we have things like the policy is a challenge. There are scattered policies here and there that needs to be harnessed so that they speak to one another. And then there is the government support, lack of coordination between authorities. Like now in Kenya, we have the county governments. So how do we, even as organizations, work with governments and also as well as the people who are the consumers of our products? And then we have multiple partners, sometimes requiring time to work to bring partners together, and sometimes even competition among partners. These are things that really interfere with collaboration. And then we have the staff capacity. So you will find that one organization is strong in this area, and in another area they are lacking. So there are those capacity issues that should also be handled. And then we have now the users, the consumers of the services. So issues of stigma, safety concerns, lack of acceptance, lack of knowledge on technology use. So then there is also a question on which factors facilitate early stages of cross-sectoral projects. So if you want to work cross-sectorally, what are some of the early stages, what are some of the factors that would facilitate that? Then we have the attitude. So you have to have the positive attitude and also the willingness to collaborate with other sectors. You start small and then plan to grow. Don't take everything at the same time. And then there is the issue of willingness to learn. Local engagement, try as much as possible to bring the local communities into whatever you do, always. And also there is need for research. And yes. So these are just some of the members we held. We have been working this one through workshops. I'm just finishing. This photo was taken during some of our interactions as members from Sweden, from other places, and we had a conference here in Nairobi just to share, just like this forum that we are having today. Yeah, so during that forum, we visited partners just to see on the ground what they are doing, and also as well as talk to communities. For example, we visited the work of Synergy, looking at how they are converting the human feces into fertilizer. We visited also the Salvation Army, the work that they are doing with the energy, converting even human waste in biogas, where we have some groups that are converting human waste and getting energy like biogas and using that one even to cook food and the rest. So the key messages and learning that cross-sectoral projects require more resources, time, funds, and knowledge and skills. But you should not lose hope because once you have invested in working cross-sectorally, the benefits, there are high impacts working cross-sectorally as opposed to working in silos. Yeah, I think the rest you can read. I think that one is possible. And to get more of what we have done, even in depth of those case studies, I've provided a link there. Thank you so much.
All right, thank you.